I've always known that Columbia Care was interested in understanding what patients need because of the data that we've been collecting, again, since 2014. From the very beginning, we weren't interested just in, selling a product. We were interested in learning from patients, having patients tell us what they need, what they want, what works best. That's where we start. We know what's in the product and we know what's not in the product, and we'll tell you both of those things. And what we're doing at Columbia Care is really trying to unlock a lot of this information and determine what combinations of cannabinoids are best for what treatments for what diseases.
This is my grandson, Jared. Jared is 14 years old and a handsome little devil, aren't you? Before he was born, he was deprived of oxygen for 6 hours. He had severe brain damage, which resulted in cerebral palsy, epilepsy. He's had some seizures that it will knock him right over. If he's laying in bed, it will roll him right over. With this opioid, you would have fatigue, diarrhea, constipation. The side effects were just unbelievable.
Every single doctor you talk to will tell you the less amount of time you can be on opioids, the better. I was 8 months away from getting married, and I had a seizure one night, and I was diagnosed with brain cancer, and I'm a year and a half into that fight now. The whole idea in my mind was to try to figure out a course of treatment that allowed me to get back to what I was doing every day.
When I was 15, they started me on opioids. My life has never been the same. I'm 30 years old, and I have 2 kids. I have sickle cell disease. I was born with it. Anywhere you have blood, I can get pain. So I can get pain sometimes in my chin. I can get pain in my lungs. The opioids never take away the pain completely. It just kind of masks it a little. My body is very dependent on it. Just missing 1 dose, and in 2 or 3 hours, I'm sweating. I'm hyperventilating. I'm anxious. I'm just like jittery. I know I have a health condition, but I just feel like a regular drug addict on the corner. I see those people and I just start crying because I'm just like, oh my God, is that gonna be me soon? Like, am I gonna look like that?
Sometimes patients come to me and they say, look, I don't want to be on these drugs. I don't want to be taking, morphine and Zofran and things like that and have all the side effects associated with it. Is it possible that medical cannabis could be used? I've seen the benefits for patients who have a serious illness in terms of reducing their pain and other symptoms that they're struggling with without the same burden that they often have with some more conventional therapies like opioids or other kinds of pharmaceutical treatments.
My appointment with Dr. Blinderman was one of the most intense doctor's appointments I've ever had. We spent a lot of time talking about, what my options were, what would make sense, and why medical marijuana might be a really viable alternative to a lot of the other medicines that my team was recommending. Everything else had been, you're crazy if you don't do it this way. There isn't a right answer here, and it's whatever works for you, and that was refreshing.
I started searching the web for the medical marijuana doctors. Columbia Care, we're very fortunate, is about 20 minutes away from us. When I first started, I think I called there every day with questions. Never upset, whatever it takes to make you, to ease your mind.
Nothing whatsoever would give it away as a marijuana dispensary. You think you're going into a regular doctor's office. They just try to give you options and to see what works best for you.
The way that I always describe Columbia Care to my friends is it's like the best doctor's appointment you've ever had. There's never a wait, people are super friendly, all the cards are on the table, you know what it cost you. It was extremely straightforward. The people were both practical and thoughtful and extremely informed. It's the best doctor's appointment I've ever been to without actually seeing a doctor. They spent time with me, helping me to understand what different options there were even within their own product set and what would probably work best for me. They had recommended a high THC to CBD ratio to help inspire appetite. I was eating more, I was sleeping better. I can really proudly say I never took a day off of work because I felt sick during treatment.
It was just a big, drastic change for me and my family. I'll just wake up pain-free, and I haven't had that in a long time.
Within 2 days of Jared starting the medical marijuana, he's awake, he's alert. Now he's rub-a-dub-dubbing again, which means he's happy. He's functioning, to his level again. Maybe to somebody else it's nothing, but to him, this is his world. He's doing far better on the medical marijuana than anything else that we've tried.
Why wouldn't I use it for myself to take away my chronic pain that debilitates me and prevents me from being the best me, the best mom, the best wife, the best person that I can be, that I want to be? So why wouldn't you do it? Like, why wouldn't you take away someone's pain?
Since my diagnosis, I've been promoted, I've gotten married, my dog's a year old, and life is really good. Life is normal, and that was the goal the whole time.